Mr. Speaker, and I do want to thank my colleague from Illinois, Mr. Rush, for yielding time for me today to speak on this important bill. I am pleased to rise in strong support of S-920, the National Clinical Care Commission Act. S-920, as was mentioned already, creates a commission comprised of clinical endocrinologists, other physician specialists, primary care physicians, healthcare professionals, patients, and representatives from the federal agencies most involved in diabetes care. The Commission is charged with making recommendations to streamline federal investments in diabetes to improve the coordination and clinical care outcomes for people with diabetes, prediabetes, and other insulin-related metabolic and autoimmune diseases. Passage of this legislation will help the nation undertake more proactive and innovative approaches to diabetes and its disease complications, for which the United States spends some $322 billion annually. I urge the Secretary also to move expeditiously to set up the Commission so it can begin its important work as soon as possible. Clinical training and expertise in diabetes and other insulin-related diseases will be needed to lead the Commission, and it is my hope that a clinical endocrinologist will be chosen to serve as the chairperson of the Commission. I think that's very, very important. With a clinical endocrinologist as chair and representatives from other medical specialties, healthcare professions, and patient advocacy groups serving alongside with federal diabetes experts, the Commission created under S-920 will help to ensure that new innovative medications and devices are effectively translated to the clinical setting for the benefit of patients. That's so important, that clinical translation. The work of the Commission will help improve the lives of the tens of millions of Americans living with diabetes while simultaneously beginning the process of reducing the staggering impact of diabetes and its disease complications and the dollars that has already been mentioned associated with that. I want to thank in particular Representative Olson for his persistence, as was already mentioned, for sponsoring this bill in the House. And I was very happy to lead the way as the Democrat on this side of the aisle on this bill, and for my colleagues on both sides of the aisle who supported this bill that enabled House passage of the legislation earlier, as was mentioned, and now we're finally going to get it over the finish line. And thank you again, Mr. Speaker. I thank Representative Olson in particular for his efforts on this, and I yield.